Vision impairments and their definitions, deficits, and adaptations for para-alpine skiing. This is the basic anatomy of the human eye. When damage occurs to any part of the eye, a key visual skill could be affected, or a vision impairment can occur. The basic mechanical skills of the visual system include the 17 key visual skills. These skills include eye movement control, binocular coordination, saccades, pursuits, convergence, accommodation flexibility, accommodation endurance, visual memory, visual thinking, central visual acuity, peripheral vision, depth perception, color perception, gross visual motor, fine visual motor, visual perception, and visual integration. When working with someone with a vision impairment, an assessment of the student must be conducted to gain information. This assessment includes gaining information about the cause of their diagnosis, the prognosis, if the disease is progressive, corrected devices they use, their degree of contrast sensitivity, their level of visual acuity, their visual field, issues related to color vision, vision-related mobility challenges, and depth perception. The Professional Ski Instructors of America, also known as PSIA, identify 9 primary vision impairments. These are cataracts, corneal diseases, detached retina, diabetic retinopathy, glaucoma, macular degeneration, myopia, retinitis pigmentosa, and strabismus. Cataracts occurs when the lens of the eye becomes cloudy. This leads to trouble seeing at night, sensitivity to light, and clouded or blurred vision of the entire field. Corneal diseases include keratitis, keratoconus, corneal dystrophy, and corneal ectasia. Keratitis, also known as conjunctivitis, causes temporary eye pain and blurred vision. Keratoconus occurs when the cornea gets thinner, causing blurred vision. Corneal dystrophy occurs when fluid builds up in the cornea, causing blurred vision. And corneal ectasia occurs when the cornea is too thin and weak. This can be corrected with glasses. A detached retina occurs when the retina in the back of the eye pulls away from its normal position. People with this impairment often see many floaters that drift through their field of vision. Diabetic retinopathy occurs secondary to diabetes when the blood vessels of the light-sensitive tissue at the back of the eye become damaged. People with these impairments often see dark spots and strings floating in their vision. Glaucoma occurs following damage to the optic nerve. This causes peripheral vision to gradually disappear. Macular degeneration occurs due to the breakdown of the macula, the part of the retina that gives the eye central vision. This leads to a decrease in central vision. Myopia, also known as nearsightedness, is a common vision impairment in which objects close are clear, but objects far away look blurry. This can often be corrected using glasses. Strabismus is a dysfunction of the muscles controlling the eye. This causes eyes to move in unstable directions, often leading to double vision. Retinitis pigmentosa affects the retina and leads to the loss of night vision and peripheral vision. Assistive devices that are frequently used with visually impaired participants include headsets to give the participant verbal instructions while out on the ski hill, a hula hoop, pole, or steering wheel to hold onto to guide the participant, and goggles to assist in controlling light irritation and shadows. The instructor can guide the participant one of 3 ways, depending on the participant's preference and ability. These include using visual cues to guide, which involves skiing in front of the participant so they can follow, auditory cues, which involves using the headsets or clapping your poles together, and kinesthetic cues, which involves using hand-on-hand assistance or an assistive device. Guiding positions include guiding from the front while skiing backwards, guiding from the front while skiing forward, guiding from the back, and guiding from the side. Many participants use visual, auditory, and kinesthetic cues all together while participating in a lesson. While guiding, using the acronym DIRT can be used to help the student develop rhythm and flow. Through cadence and tempo, you convey information about the duration, intensity, rate, and timing of desired turns. An example being that short radius turns will be delivered more rapidly than long radius turns. During lessons, the participant and instructor will both be wearing bright orange vests labeled guide and visually impaired to warn other skiers on the mountain to keep a safe distance. The orange color is also easier for the participant to see if they are being guided using visual cues. The benefits of skiing for someone with a vision impairment includes an increased sense of independence, an increased sense of self-confidence, and increased social participation. There are several risks when people with a vision impairment ski, including the inability to see people, signs, trees, and objects, an increased risk of getting lost without a guide, and decreased depth perception to see moguls and the pitch of the run.